Welcome to the Cadia Rehabilitation Admissions Training video. Whether you're a new hire or a current employee just brushing up, this video is meant to serve as a guideline to Cadia's Rehabilitation's multidisciplinary approach to the admissions process and the hospitality expected from you as a member of our staff. Let's get started. After receiving notification of a new patient admission from our admissions director, the staff nurse will immediately begin to prepare for the patient's arrival. A critical first step in the admissions process is to obtain a thorough and accurate telephone report from the discharging facility. This is done to anticipate any needs the patient has before he or she arrives, including but not limited to mobility needs, medications, as well as the patient's overall general medical condition. Getting a detailed and accurate report of the patient's medications is critical. We want to continue medication administration without interruption to assure the patient's recovery and, most importantly, to address any pain issue that may be present. If the patient is experiencing pain and a physician's order is in place, secure pain medication from the pharmacy emergency box immediately. If there is no order for pain medication, it should be secured from the physician as soon as possible. After collecting this information from the hospital, the staff nurse will initiate necessary paperwork and preparations in anticipation of the patient's arrival. This includes a visual inspection of the patient's room, assuring that it is in order and that all necessary equipment is available, such as an alarm, a wound vac, oxygen, or a specialty mattress. The nurse will also give a brief report to the CNA, or Certified Nursing Assistant, who will be assigned responsibility for the incoming arrival. It is our responsibility to make the patient feel welcome and comfortable upon arrival. Their current situation is very stressful, and we want to make the transition as easy as possible. This means the greeting process must begin in the first 5 minutes of a patient's arrival. Remember, your first impression is a lasting impression, so compassion for and engagement with the patient is vital. If possible, the CNA should be on hand to be introduced and to address any immediate needs or requests the patient may have. After greeting the patient and escorting them to their new living accommodations, the staff nurse addresses any immediate needs before she begins her assessment. Do you need to use the restroom before we get started? Do you have any pain? Do you need anything to drink? It is also very important that the patient understand why he or she is here, especially as it relates to rehabilitation. Next, the nurse explains the whiteboard and the use of the call bell. The whiteboard provides important information that may change every shift. That includes the nurse and CNA assigned to them on the current shift, their therapy appointment for the day, and other important information. Finally, place the call bell within reach of the patient and explain how to use it. Make sure to have them demonstrate they know how to use it. After explaining the next steps to the patient, the staff nurse will then perform a head-to-toe assessment and skin check for any wounds that they may have acquired previously at the hospital and indicate any wounds or marks found in the new wound alert form. This step is a crucial one as it eliminates the possibility that the wound was acquired while in our care. Understand the vast majority of patients are here for rehabilitation, and thus, at this time, it is important to further discuss any concerns they may have with pain management. The staff nurse will then make sure the patient knows their attending doctor's name and when they can expect to see the doctor. Next, notify the CNA to introduce or reintroduce themselves to the patient, explain their role, and to begin their responsibilities in the admission process. Before you excuse yourself from the patient, make sure to always ask, "Is there anything else I can do for you?" The CNA will be given the responsibility of taking the vital signs and weight of the patient, recording them, and reporting to the nurse. The CNA will also have the task of learning the personal habits and routines of the patient, their desires and preferences, such as what time of the day they like to take a shower or what type of foods they like. They will also take an inventory of personal items and secure any valuables they may have. As the staff nurse fulfills his or her duties, our desk nurse will have the responsibility of filling out any other necessary paperwork, such as reconciling the patient's medication orders, faxing them to the pharmacy, and putting them into the computer system. All orders must be to the pharmacy within 30 minutes of the patient's arrival. After both nurses have finished their respective duties, they will meet together to compare the staff nurse's physical findings with the discharge orders that accompanied the patient and address any necessary support or changes needed. The nurse will then call the attending physician to report their assessment findings and receive any additional orders. After the patient is settled into their new living accommodations, depending on what time of day they arrived, they should expect to be visited by several members of our professional staff, either that day or the next. Make sure they know beforehand that they will meet with a social worker, a dietitian, a member of the activities department, and most importantly, a therapy rehab specialist. The social worker becomes familiar with various dynamics of the patient's life, including, but not limited to, religious preferences, family dynamics, and anticipates any service or equipment needs upon the resident's discharge to home. The dietitian will go over food preferences, dietary restrictions, fluid needs, and will calculate healthy protein and caloric requirements for optimal healing and recovery. A member of the activities department will be interested in what the patient's hobbies or interests are. Together, they can discuss the daily calendar of entertainment and events that are offered and customize an itinerary of the patient's likes and dislikes. Finally, depending on what time of day the patient is admitted, the therapist will meet with the patient that day or the following day to discuss their rehabilitation plans. A physical, occupational, and speech therapist will evaluate the patient to assess their current level of function, establish goals, discuss the therapy schedule, the amount of time each day the individual will spend in the therapy gym with the therapy team, and design a treatment plan for a safe discharge from our facility. After the patient has adapted to their new environment and settled into a routine schedule, they or their family members will fill out an admission satisfaction survey, where they will rate their experience upon arriving at Cadia Rehabilitation and their opinions of the facility, ranging from the quality of care the nurses provide to the quality of meals and more. If something is unsatisfactory to the patient, it will be addressed immediately by the department head. To recap, our goals and aspirations with the admission process at Cadia Rehabilitation are to welcome the patient in a friendly, compassionate, and professional manner, and to supply them with exceptional customer service in all areas of their stay. We hope that you learned a lot from this informational training video and trust that if you have any further questions that this video did not address, that you will feel free to ask an appropriate supervisor.